I've had the chance today to hear from multiple staff at the Royal Alex Hospital here in my constituency. And they've reported a number of things to me. First of all, a severe staffing shortage that has led to the closure of about 18 beds. There are multiple critical staffing requests that were issued yesterday for both nurses and support staff to try to address that issue. The emergency room is, as a result, backing up, and that's impacting patient care. And the burnout from COVID that has already led to low morale is being worsened significantly by the wage rollbacks that we've been hearing that are being demanded by the UCP government. Now, I just want to read from a note that was sent to me by one worker who we also followed up with and spoke with today, who asked not to be identified for fear of reprisal from AHS. That worker said, and I quote, "Beds will be closed again today. Having beds closed causes the bottleneck of patients throughout the day. This cycle continues and affects both patients and health workers, including doctors. We're being tasked to the maximum, and it's impacting patient care. I feel if unaddressed, this will set us up for a critical failure this weekend when demand increases." They told me clearly that these beds are not closing just because of burnout and staffing issues, or, as the minister said, because of vacations, but also the deep lack of respect from Jason Kenney and the UCP as they push back on Alberta healthcare workers' wages, even as we are just coming out of the third wave of the COVID-19 pandemic. These are not separate issues, as the health minister has claimed. The UCP's utter lack of tact and consideration for frontline healthcare workers is adding to this problem. It is demoralizing the workers and increasing the pressure that they feel on the front lines. So once again, I am calling on Jason Kenney, Tyler Shandro, Tavis Tays, the entire UCP government to recognize the immense pressure that COVID has caused for healthcare workers, what they have endured over the last 16 months, and to start negotiating respectfully, and to bring forward a plan to address these critical staffing shortages at the Royal Alex and across Alberta. I would also very much like to see a clear indication of what steps are being taken, what supports are in place to help these healthcare workers as they recover from what they've endured during the 16 months of the COVID pandemic.